Kelly.
Hey, good morning, Shelley. Really relevant topic here in light of recent events that we've been seeing around our country, violent experiences. This is knowledge that everybody should be equipping themselves with, and Operative Experience has been kind enough to let us into their home right here in Bel Air. We have Mick Naven, the CEO. Thank you so much for being with us.
Thank you for having me.
Yes. So before we go ahead and show the models that you have here for this, I do want to give a warning. They are a little bit graphic, so if you're drinking your morning coffee, set it down. And Mick, you can go ahead and tell us a little bit about what this is all about.
Sure. So 80% of all civilian trauma deaths are due to uncontrollable bleeding. 50% of all combat trauma deaths are due to uncontrollable bleeding. So the control of hemorrhage is key to saving lives. And the speed with which you can do that is also key to saving lives. So the way to combat that is through proper training. And the best way to have effective training is with realistic simulators. You need the realistic simulators which have lifelike tissue, which have realistic wounds, realistic bleeding. These simulators also bleed and breathe. You even have two-way communication, so you can have moaning and things like that. So the trainee needs to be comfortable and confident, and they get that confidence through the use of the basic hemorrhage control techniques on simulators that are lifelike.
So this is something you guys invented yourselves, and who gets to use these? Who trains on these?
So we currently these are currently used by the military. They're used by the Marines. They're used by the State Department. They're available to be used by first responders and police departments as well. And as you mentioned, with the active shooter situation, with terrorism, with explosive devices, this type of training is very effective. The techniques for controlling hemorrhage are easy to learn, but you need the confidence in dealing with the blood and the situation, and that's why you need the realistic simulators in order to get that confidence.
Great. Well, Mick, thank you so much for having us this morning. Throughout the morning, Mick is actually going to be using these models and showing us how they work and what you can do if the worst should ever happen. So stay with us on Fox 45. For now, Shelley, let's go ahead and toss it back to you.
All right, thank you, Kelly. We'll see you in about 30 more minutes. Kelly Anderson is live in Bel Air this morning where a healthcare simulator is showing you how to respond in an emergency. Good morning, Kelly.
Hey, good morning, Shelley. Just like you were saying, this is something that we don't really want to think about, but in this day and age, with all the violent school shootings that we see happening, it's something that maybe you want to equip yourself with. Just the way that you equip yourself with CPR knowledge, you might also want to equip yourself with the knowledge of how to stop a hemorrhage. We're here with Mick Naven with Operative Experience. Thank you so much for being with us so early.
Thank you for having me again. Yes.
Yeah. So, this, like we're saying, this is a very timely topic. We're about to see some models here that your company has developed. They're a little bit graphic, so we want to give that disclaimer that, if you're sitting with kids at home right now, it might not be something that you want them to see. This is more for the adults.
That's right, yes. And we want them, one of the keys of training is that you want your trainee to be confident. So they need to have realistic models, which is why they are a bit graphic. So they have realistic skin, they have realistic wounds, they have realistic bleeding. So let me show you one of the models we have here.
Yep.
This is a full-body bleeder. This has various wounds. Now, any one casualty wouldn't have this many wounds, but we have gunshot wounds, which can be controlled by a tourniquet application. The tourniquet application is fairly simple to learn, but again, they need to understand and be in a pressure situation, in a crisis situation, which is why the models are so realistic, in order to really do the tourniquet properly. This also has what would be like a shrapnel wound on the leg. So he's got a broken tib fib here, which is also bleeding. And then he's got, in this particular area, he's got a traumatic amputation above his right wrist. So all of these different bleeding wounds can be controlled by a tourniquet. They can also be controlled, the gunshot wounds can be controlled by wound packing, which is simply packing the wound with gauze. We will demonstrate how you stop the bleeding on these different wounds, I guess, in the next segment.
Yeah, in the next segment we'll take a look at this. Just a really quick question. So, should everybody be equipping themselves with tourniquets these days?
Well, I think that there's techniques you're going to learn when you use the body, and tourniquets are not particularly expensive to use, but there's also different techniques you can use to affect kind of a simulated tourniquet at the same time.
All right, Mick, thank you so much for being with us this morning. Stick with us here on Fox 45. He's going to actually be showing us how to use his tourniquets in the next half hour. Now, Shelley, back to you.
All right, thank you, Kelly.
Hey, good morning, Shelley. All morning long, we've been talking about how important these skills are. You know, you equip yourself with CPR knowledge, with naloxone knowledge. Stopping the bleed is something that you should also be aware of. I want to warn you that what we're about to see is a little bit graphic, so if you're with children, it's something to be aware of. Maybe put down your morning coffee. I'm going to go ahead and introduce Mick Navin. He's the CEO of the company. Mick, thanks so much for being with us.
Thank you. So what we're going to show you now is, you've seen our simulators in the previous segments. What we're now going to do is we're going to show the primary method of hemorrhage control, which is a tourniquet application. So you see my colleague Will Tingen, he's going to apply a tourniquet a little bit slower than you would in real life, so you can see. So it's 3 fingers above the wound. He places the tourniquet underneath. And a tourniquet, basically what it does is it's a strap that will control and compress the artery. So it's a simple technique. It can be applied quickly. And you're going to see it, basically he straps it on. And then this will, the next step is to turn the lever to increase the pressure on the artery. So we've got bleeding going from multiple locations in this particular, in the leg, and this will stop the bleeding. It's a pretty simple technique. Everyone can learn it. Again, the realism of the simulator enables them to be able to respond under pressure. That's the key to training, that they see realistic, they see blood, they're used to the blood. The application of the tourniquet, as you saw, was very, very simple.
So, I mean, these are military-grade models. I mean, we have him covered up right now, but that's actually an amputee that you're looking at right now.
Right.
But, you know, in most unfortunate day-to-day situations, it's going to be more gunshot wounds, that
Correct.
kind of thing.
Yes.
So what if you don't have a tourniquet? What can you use?
Well, as you saw the technique, anything that you can do to put pressure. So even if you have like a shirt that you could tie to knot the shirt, and then if you have a stick, a pen, something rigid to put in the knot, and you can just turn it, which will, again, increase the pressure on the artery. I'm recalling back to my days in the Boy Scouts when they taught us how to do that. You know, like I said, just tying a shirt around and then putting a stick in the knot and tightening that knot. And you can see it you can visually see that the bleeding stops.
Yeah, wow. These models are super impressive. You guys, yes. And we were talking earlier this morning that they're a little bit too lifelike. We have to be careful about what we're showing on TV here. But Mick, thank you so much. This has been wonderful.
Great.
Thank you.
Thank you.
So we're going to be learning more about this all morning long. So if you want, stick around with Fox 45, and we'll be showing you other injuries on the models. For now, Shelley, back to you.
All right, Kelly Anderson, live for us in Bel Air this morning. Thanks, Cal. Morning, where a healthcare simulator has been showing us how to respond. Good morning, Kelly.
Hey, good morning, Shelley. Like we've been saying all morning, this is a very relevant conversation that we should have right now. You know, we talk about naloxone training, we talk about CPR training, but what if somebody is bleeding out in front of you? We have Mick Navin with us this morning to show us these models. I should alert you, they are a little bit graphic if you are with children. This is something you're going to want to be aware of, the content that we're showing. These models are really advanced, very lifelike, Mick.
So the next technique we're going to show you is simply it's really wound packing. So there's a gunshot wound that actually goes all the way through the thigh, and all he's doing here is packing it with gauze, and then he'll wrap the wound, the gauze around the wound to keep the gauze in place, and that will also stop the bleeding. Again, it's something that you're probably thinking that would be difficult for you to do if you saw someone with an open wound, which is why training really helps in generating the confidence you need to do this sort of thing. Now, I will mention, if it's not a serious wound, the first step is always just to put pressure on a wound. But in this particular case, and the type of training we're talking about, they're more serious wounds.
Yeah, it looked like it was a pretty deep gunshot there. And then above it, what we're looking at is a tourniquet. You guys were saying earlier that that's kind of the last resort, right?
Yes. So yeah, the first thing you want to do is put pressure on a wound. But this is a serious wound. In this particular case, a tourniquet was called for because the gunshot went all the way through the leg. It was arterial bleeding, and he even has some bleeding from the open tib-fib fracture in the bottom of the leg as well. So
okay, and Mick, I mean, these, like we were saying, these are military grade models you have here. I mean,
yes.
This gentleman we're looking at right now is actually an amputee.
Yeah.
It's probably something you wouldn't encounter in a everyday violence type situation. But do you think stuff like this, wound packing and tourniquets, is something that the average citizen could do?
Oh, absolutely, yes. Like I said, and like you saw, the techniques to stop the bleeding are pretty straightforward and pretty easy to implement, and anybody can really do them. The question is, if you know the techniques, you can be confident in how you apply them. So in this case, when you're using a simulator and you get used to blood, you get used to the movement, you'll be confident in how you can do these things. And like you saw, they're pretty simple to implement.
Wonderful. Thank you so much, Mick,
Thank
for being
you.
with us all morning. We will be learning a couple more techniques throughout the morning right here on Fox 45. For now, Shelly, back to you.
Good morning, Kel.
Hey, good morning, Shelly. Like you said, it's a situation you never want to find yourself in, but just like anything else, it's always better to be safe than sorry and be prepared with the knowledge you need to get you through. So we are here with Mick Naven of Operative Experience. He's been so helpful all morning long. We've been talking about tourniquets, filling wounds. We have the models here. They are a little bit graphic if you're with children. That's something to be aware of. Mick, what are we talking about? What can people do if they find themselves in a bad situation?
Well, let me show you the simulator here again. So this is like Kelly mentioned, it could be graphic. We've kind of toned down the blood flow here, but you see a gunshot wound here, you see a shrapnel wound here, both of which are bleeding, and both of which could come from an active shooter situation or an explosive device, such as like the Boston Marathon bombing. And we've talked about putting pressure on a wound as a simple technique that you can do. We talked about packing a wound, which is inserting gauze and literally just pushing gauze into the wound, and then a simple tourniquet application. So you can see that the tourniquet is 3 fingers above. I mean, the tourniquet is in place here, but it's 3 fingers above the wound itself. And then you tighten the tourniquet as much as you need to shut off the blood flow. So in this particular case, you have a tourniquet, and it just stops the blood flow. Simple techniques that really anybody can learn to do. And one of the keys is just to act quickly and confidently. The techniques are simple. I think you've seen them on the simulators. And in a chaotic situation where there's blood, a lot of moaning and maybe some screaming and things like that, if you can get past that, you can be confident in the techniques that you know. Like I showed you, they're very, very simple. You pack the wound, you put pressure on the wound, you put a tourniquet on the wound. And all of those things are things that people can learn. Hemorrhage is the #1 cause of civilian trauma deaths. It's the #1 cause of combat deaths as well. And a lot of those deaths can be prevented with these simple techniques.
Great. Something you can do at home. Even if you don't actually have one of these tourniquets, you can still use a t-shirt.
Sure.
Yeah, great. Mick, thank you so much for being with us all morning long. Just something to prepare for. Hopefully it never happens to you. But if you find yourself in this situation, now you know what to do. For now, Shelly, back to you.
All right, Kelly Anderson, live in Bel Air. Thank you.